Okay, I'm going to start with the hip palpations. So here is ASIS. The sartorius is lateral to medial. The rectus femoris is straight down the middle. Vastus lateralis is here. Vastus medialis is here. And the vastus intermedius is under the rectus femoris. And then we have the adductors in here. Then PSIS is right here. Ow! Oh, I just tweaked something. The gluteus maximus is her bum. And then, oh, I forgot. The ischial tuberosity is okay if you're not.
Yeah.
Right in here. Okay, back up. Turn around. The hamstrings are right here. The iliac crest is just this hip crest. There we go. The TFL is right here. And then we have the glute med up in here. And then the greater trochanter is right here, and you can feel this when they internally and externally rotate. And then the IT band is right here. I love it. Okay, now we're going to go to the pelvis palpations. So we're gonna go ASIS right here. Umbilicus is her belly button. McBurney's point is on the right side between ASIS and umbilicus. It's like right here. Isn't that weird? Yeah. And then the SI joint is like from PSIS like down right in here. Okay, so we are going on to special tests for the pelvis. So first I'm just going to measure for leg length. So I'm going to go from the ASIS to the medial malleolus, and I'm just going to measure that there. Then I'm going to have the patient lay on the table, and I'm going to do the gapping compression test. And pretty much what I'm going to do is I'm going to put my opposite hand over the ASIS, like this, and then I'm going to gap and push down like that. And if there's a pain in the SI or gluteal region, that would show SI dysfunction. So then I'm going to do the long sit test. I'm just going to grab, can you sit back a little bit? Yeah. I'm going to grab both malleoli, and I'm just going to see where my fingers are. Just measure them out here.
I literally can't with their sounds.
Okay. Then have the patient sit up. Never mind. Wait, go back down. Okay. Then I'm going to have the patient sit up, and I'm going to pull them. Go 1, 2, 3, go. So there was no change, but if there were a change, then that would show anterior or posterior rotated ilium. And then last, I'm going to do the McBurney's test. I'm going to go from the ASIS and the umbilicus. I'm going to go right in between those two. So I'm just going to find that. I'm going to push in and out. And pain with the, when I get out and there's pain, that would show appendicitis. Okay, I'm going to go on to special tests for the hip. So I'm going to start with hip scoring. So I'm going to have the patient lay on the table, and I'm just going to go like this, and I'm just going to internally and externally rotate, pushing down on the knee, and trying to kind of grind that hip, and I'm just looking for pain there, and that will show a labral pathology. Then I'm going to move on to the torque test. So I'm going to have the patient stay here. I'm going to put my fist under here, and I'm just going to apply a force right here, looking for that gapping, and the pain would show a femur stress fracture. Now I'm going to have the patient, this is called the 90-90 straight leg test. I'm going to have the patient raise both their legs and raise one at a time on their own, and I'm just looking to see how straight they can make their leg. And she doesn't have like super bad tightness in her hamstring, but if they were to have that, you would see a lot of hamstring tightness if they weren't allowed, or if they weren't able to straighten their leg fully. And then the Patrick Faber test, I'm going to have the patient go in like a figure 4 stance and just drop their leg and relax as much as they can. So this one, as you can see, her leg does not fall down to the table. It's supposed to be all the way down here when she relaxes, and so it just shows SI joint involvement and just a really tight IT band. And then I'm going to have the patient stand up. This is the Trendelenburg test. I'm just going to have you stand on one leg. And she, as you can see, her hip dropped just like the slightest bit. And when their hip drops, that just shows a weak glute med or hip instability, which makes sense because she got surgery. Okay, part 2. So I'm going to start with the over test. So I'm just going to come over here, have the patient lay on the table on their side. I'm going to grab her ankle and her knee. And I'm just going to go up and out, and then I'm going to drop. And honestly, that was good. I can't tell a lot. But we're just looking for how far that knee is going to fall down when I let go. And that would show a tight IT band if it weren't to drop as much. Then the piriformis test. I'm going to have the patient kind of stack their legs onto each other. And I'm going to come on this side. I'm just going to grab her hip and her knee. And I'm just going to pull and push down on the knee. And I'm just looking for pain in the hip or the butt, and that would show piriformis syndrome. And then lastly, I'm going to do the Thomas test. So I'm going to have the patient lay. I'm going to have the patient lay like this, and I'm going to have them have their PSIS on like the edge of the table. Grab one knee and rock back.
That's where I like.
Perfect. So we see that hers is honestly a little tight. It's supposed to be pretty bent, but it's honestly not too bad. Worse would be straight. We're just seeing how far their knee is bent. And so we just see the psoas tightness with that one.